Always good to see you, Cam.
It's 12:05. I want to say a big good afternoon to each and everyone of you here present. Welcome to the Global Health and International Exchange Faculty Forum meeting. And we have quite a good number of things to discuss today. But again, I want to say a big thank you to Kim and Stacy Radar for always working diligently to put the meetings together. I also want to give a big shout out to Dr. Kovac, who had a very good visit to Ghana and met with very important people. I won't be surprised if the next time you go, they make you a minister for health or the vice president or something. Because you're becoming almost Ghanaian than any of us. Anyways, congratulations and welcome back.
Thank you.
And well, a big congratulations to someone who we have always interacted with as well, Dr. Alfred Edu, who has been made the health ambassador to the Ashanti region in Ghana. That's really very good. We all have interacted with him one way or the other. Okay, so with that said, again, thank you all for what you do. I will hand it over to Kim, who
Thank
will
you.
run the meeting.
Thank you, Dina Kenwantan. Like I said, it's good to get back together after this summer and continue sharing about our work in the space of global health and international educational exchange. I wanted to start first by putting in a plug about upcoming events. Most of you receive our emails. They typically come out on Monday, and they typically come from Alexa Smith. If you're not receiving those emails, please let us know. Most of our educational events are by Zoom. Our Foundations of Global Health that we are running along with the African Trauma Initiative and the International Orthopedic Trauma Collaborative, that's hybrid, so it's both in person and by Zoom. So I encourage us to support each other in our programming and our events around global health. It helps us to build our community, and showing up for each other creates synergy and enthusiasm. So I appreciate those of you who come to the events. I know not everybody can make everything, but we do have an end of program celebration for our orthopedic fellow, Dr. Beza, and our Redford fellow, Miss Mabel, and that's today at 4:30, and it's at our house, KC. Many of you have received that invitation. If you need more information, if you're able to attend, let me know. Our house, KC, is right on 39th Street. I see I neglected to put that on the agenda, but that's where it's at. What I like about this event is it's a combination of School of Medicine, the health system, School of Nursing. So there'll be a lot of people there that engage in the space of global health and international educational exchange. We talked, Dina Kenwantan and myself, and part of the goal of this forum is to give a platform for sharing about our projects and programs ongoing. And so I wanted to highlight a couple of individuals who had activity over the summer and who are ongoing activity into this fall. We're going to start with Dr. Cochran, and then Lisa Trujillo actually had a family emergency, so she won't be here today. We will move her to our next meeting. And then Dr. Anthony Kovac will talk about his activities this summer, which Dina Kenwantan just alluded to. And Dr. Rachel Sigler is on the call. She also will report on her summer activities, but we're moving her to our next agenda as well because she just returned from out of town late or early this morning. So with that, I'm going to pass the microphone to Dr. Cochran. Welcome, Dr. Cochran. Thank you so much for sharing with us today.
Thank you. I will share. It says I'm sending a request to replace the current sharing. So,
I just stopped sharing, so you want to try again?
mhm. No. Is that okay?
Yes, we can see you. Mhm.
Okay. Okay, I'm presenting today on a project that was funded by the COVAC International Fund Award, and the intent was to build global health competencies through virtual international partnerships. The project is called the Global Health Partner Interview Project, and it is part of a Global Health Perspectives course that I teach. And we give the students foundations of global health, and then they interview a global health professional that's currently working in the field. They're prepared with different information, and then they compare that information to real world insight when they speak to the partners. And it is an opportunity that the students typically don't get before or after, according to their feedback. And it helps them understand and address global health challenges and gives them a global lens to look at current events. So I kind of got a little crazy with the number of aims. So I just highlighted essentially why I was doing this, the gaps I was seeing in my students. So I wanted them to apply global health concepts to real world settings. I wanted them to synthesize the practitioners' insights with the academic foundations we give them, the textbook foundations. I wanted them to understand resource varied environments that have good outcomes. So they understand that the United States often has poor outcomes than innovative, low resource countries. I wanted them to understand the interconnectedness of global and local health, shape their clinical practice at home, develop intercultural communication skills, and understand context-specific knowledge. When they speak to their partners, I want them to understand that that healthcare system is impacted by the culture and the surrounding community and their resources. And at the end of it all, I wanted them to develop their professional identities and incorporate the fact that they're global, they have a global profession and they have global colleagues. Again, this is integrated into a course I have. It's a 2-credit-hour course. It's an elective. And within it, we also take advantage of the offering that OIP has for the global health pillars, where they take that foundational knowledge and the partners do as well. So there is a shared mental model. The partners don't have to wonder what all our students already know. And it helps the students understand too, where that the partner understands their framework of thinking. So that did help facilitate some of the engagement. Again, as I said, this was funded last year and this year by the COVAC International Fund, and OIP practices fair trade learning practice. I gave the reference here, but because of that, and to honor that, we give $250 stipend for each international partner for 2 interviews that last about an hour each. Last year and this year, this has been going on 3 years. Our first year was a pilot, but these last 2 years, we've had steady international partners. One is Dr. Adu from Ghana. And I put some of these student comments down on these slides. These are actually, the students give a presentation at the end of the semester, and some of these pictures are from their presentations. This is Dr. Evelyn Rotich. She is now a dean at one of the colleges at Kenya. Previously, she was at Moi University and practiced as a midwife. This is Dr. Mendez from Guatemala, again, one of our partners. And if you have taken the pillars, you see this in the lower right. And I had the students take it and then compare it with the country they were interviewing. So they understood the communication style in general of that country. And this is Anita Jayakumar. She is actually getting her PhD currently in Chicago. So she is one of the faculty at CMC and is a nurse at CMC. She's perioperative nurse and involved with quality improvement. Post-pandemic, this model for global health education came out, and I focus on this area for people for the interview. I can teach.
Michelle, can I interrupt for 1 second?
Yes.
I thought it was something on my screen. You have a pop-up. It says give subtitles a try, and it's actually, that's a better view actually, even though
What
for
was
some
it
reason,
saying?
for some reason it was on the wrong view. It was showing like sorry.
I'm sorry.
Can you try again from that
Yeah, I
slide?
don't even see the pop-up on my screen.
Oh, okay. Yeah.
All right. So is this better? You want me just to keep it like this on the side?
I think maybe, and you can go back to, because I interrupted you. You were talking about Anita. Sorry about that.
Okay. Let me.
I think you need to just go back
I think I was talking about my model.
Yeah, there you
that I
are.
used.
Sorry about that.
That's okay. Thanks for interrupting. I didn't see that on my screen, so I appreciate it. So the model of global health education, this is a more current one that came out in the post-pandemic years. And I can teach didactically the priorities, environmental determinants, globalization, practices, and parity, but the interviews focus on the people and how those experiences impact health. So the students do create their own questions from what we're teaching them, but this is the focus of where the interviews take place in this model. The methodology is that, again, they take the pillars and they each gain that certificate from the CFHI Global Health Pillars. And one of the benefits is this is a cost-effective virtual engagement where they can experience global health without the travel expenses to that country. And those that go ahead and travel to countries, it's an excellent introduction that helps them understand the country and the practitioners before they visit. Previously, last year, we had the same group by discipline interview the international partners twice. They interviewed them once as an introduction, and the second time they did a deep dive into a health issue. And because of feedback of the students, they wanted to do more than one country. They wanted to do all four, actually. But this year, I had two different groups interview one partner. Group one will begin a set of interviews. Group two will listen to those interviews and not replicate the questions, but do other questions that do a deeper dive. So they each get to interview two different partners. That's going on now, so I haven't gotten feedback on my current format. So on a course level, I did ask the students what course content was new knowledge. And essentially anything with global health that we're teaching is new knowledge. This is a 2 credit hour course, so I can't give them a lot of deep dive, but it's a broad brush and most of them have not heard it before. And it does grow in students with electives. The word gets around if you want to take it or not. So either your enrollment drops or increases. Unfortunately, this one does increase, and we are evolving a bit where we're focusing more on culture instead of the interventions for health issues because they're not full practitioners yet and they weren't getting that much out of interventions for health issues. I just asked them to be aware of the low resource innovations the partner comes up with. So when I did survey results, these were the results I had from last year. Most had, 89%, if I round up, had an increased understanding of global health. They were more prepared to demonstrate cultural sensitivity when interacting with others from another country. Mainly, they spoke about future patients. They can describe the benefit of seeking global perspectives on health issues. And then 100% of the classmates that responded, and The International Partners Survey results, I had 100% participation because although it was anonymous, they got a completion grade for it and everyone completed it. But 100% said they had an increased awareness that they were a member of a profession with global colleagues and that the international partner interview was impactful in learning. And I would say that when I do oral exams with these students 3 years later, 2 years later, 100% of them, of the committees that I'm on, bring up the fact that I'm on that committee because these interviews were so impactful. And they bring up the interviews in their oral exams. I would say that this does transform them in the sense that a light bulb goes off and they start viewing things within a global lens. This quote was one of the first ones that the mind was blown. There's class was nothing like I thought it would be. There are things that they just start to get an adrenaline surge at how wonderful it is these international practitioners take time out and speak to them about their practice. These were other quotes that I felt were very revealing about the impact of this. The ones in quotes were direct quotes. Otherwise, they were, I did summarize some of the quotes together. But this is just something that they're surprised is, for example, humbling to know the nearest CT scan was greater than 2.5 hours away. These are things, if they're not involved with global health, they have no idea what it's like to practice in a lower resource country. And I think you've probably read through these, but I liked the comments that the students make, and they're sincere in those comments. The program has matured. It's a continuous process improvement, quality improvement, but it has gone from, I wanted them to understand the United States wasn't always supreme in healthcare, even though we have spend more money. And so the beginning was just critical questioning. The US is not right in all that we do. And they understood that, but then I wanted them to challenge their assumptions. I wanted them to create a sense of global humility. And this focus this semester is understanding how culture and community is impacting care. It helps us expand our view and it makes it more applicable across the board. And I always ask the students this quote below, what they would tell the students next year to prepare for. So the student advice is a posting I get in the Blackboard course every year, what the previous year students advise to approach this with. The students do get a deeper understanding of global issues, and I believe this is a very sustainable growth that can be expanded because we had a pilot year, and then each year we get feedback from the students and we improve it and we improve the processes. We're developing a lot more best practices with this type of interview and this type of engagement too. There isn't a great deal out there, so it's helpful to have this time to develop those best practices for international online learning. So the broader impact is that the relationships are built and we maintain our interconnectedness. And that's why we try to focus on partner to faculty, because the students go in and out, but the relationships between faculty and the other partners are more sustainable. We've written articles together. We've presented at conferences together. So it helps to sustain those partnerships as well. And I would like for this virtual pedagogy that is being developed to be something that is demonstrated across the curriculum, because global perspectives could be in any course, not just global health. This also can introduce international educational experiences without that cognitive load of not knowing anything about the country or the partnerships or anything before you land on your feet on the ground in that continent. So it would be a good preparation for travel. And it also, if they don't travel, I do believe the students have a great deal more cultural humility when approaching their patients. So we've had 39 students total. These are pictures of Zoom meetings they had. Dr. Adu is actually at KU for one of the interviews, so he's with the students here. And if you just realize that, these are 39 students that are a healthcare professional that has enhanced global competencies and cultural humility that we have sent out, that they remember when they do their oral exams that this impacted them. So thank you very much. This was again funded by the COVAC International Fund, and I do have a belief that it's transformative to these students. So thank
you so much, Dr. Cochran. I'd like to open it up for any questions or comments. And if you don't mind, I'd like to lead with one. But obviously, I've been intimately involved and know about this over the years. What I really appreciate about your approach is that it really is underpinned by fair trade practices, not only by your providing through the COVAC Fund an honorarium to our partners and paying for their professional time, which is important for fair trade, but also it puts those international partners as experts in their culture, in their field, and our students are seeking their knowledge. The other point that I love is your goal was not only to educate our students and expose our students, but it was specifically to build faculty connections. And you've achieved that very well. Any other comments or questions from us?
Michelle, just to congratulate you on innovating and just making it happen. I remember when you started all this kind of exchange back in COVID and to see how it's evolved. And it was just sort of one thing to know about it, but to hear the comments from the students and how impactful that was multiple years later. And their training really shows this is really well worth our investment, and thinking from a global health education perspective, like how do we model what you've done and, kind of lessons learned on that to expand the number of students who can engage in this manner.
I agree. And it's also fun, right? I mean, it's a fun way to teach, and it's fun to have everybody excited. But I do think probably one of the best benefits is that some of the kinks have been worked out. So if it needed to be expanded, we have a fairly good process to translate, to scale up.
Hey, it's Richard Corntager. A couple of things. Again, this is a fantastic program. Congratulations. A couple things come to mind. One, I'm working with the Global Student Surgery Organization, and I think that's a group that would also be very interested in seeing how we could sort of maybe create something similar on the medical student side. Getting something into the curriculum I know is incredibly challenging. So again, I applaud you for being able to do that. But that's a group that I think might be interested in getting involved as well. It's obviously it's after hours stuff, but I think there'd be a lot of interest on the med school side for the students in something like this. The other thing that strikes me is, maybe a future iteration of this would be sort of following the multidisciplinary kind of program that, we've been working on for years now with Christy, and, bringing in sort of a multidisciplinary group, others, people from School of Health Professions and from medicine and all of those different groups. It would be really interesting to see how, they would be impacted in their thinking. And I think when you're talking about resource challenged areas, you may get some interesting thoughts from some of these other groups, ranging from, pharmacy to the,
Mhm.
all the other ones.
I agree. I think it would be wonderful to scale up to be interdisciplinary. And this is very organic. So if you would include that group, it, they tell you what they need. And it happens that they just verbalize. I'm shocked at the end of this, the students say, this isn't enough. We want this, this, and this also. So it is something that could be very malleable to any specific situation.
Well, as I get more, as I step away from sort of my regular clinical practice over the next 6-9 months, I'm still, I'm sort of and Kimberly knows this. I'm sort of trying to figure out, part of the what's next for me. And, these kinds of educational things, they bring me back to the stuff that Dr. Monty did and Dave Samorowski, and, being able to sort of think about following in their footsteps and how we could grow this. I'd love to talk to you more about it.
I'd love to talk to you too. And it's very motivating to work with international partners. They're easy. All of the folks that I've gotten as international partners are also faculty, so they're excellent with our students and getting them to understand. They're not just talking; they're also teaching through their expertise, but they're very good at broad level of knowledge as well. It's an easy thing to do. Maybe it's because it's our passion, but they're very easy to work with, and great things come of it. You get goosebumps after an interview.
And I
Great.
also love the fact that the partners, that you were always open to the partners being interprofessional. And you didn't insist on just having nurses, which I think it makes it rich as well. So thank you for all of that, Michelle, and thank you for contributing to our, deepening our partnerships with key collaborators. And of course, thank you to Dr. Kovac for providing the funding through the International Kovac Fund. I think, Dr. Kovac's vision has always been get the biggest bang for your buck. He is a very generous person who also has a sense of the value of a dollar, right? And so he thinks it's really important to be innovative, come up with programs that are low cost, high impact. And this is definitely one of those programs. And it's a great segue to pass the microphone to Dr. Kovac for an update from your summer.
Okay, thank you very much. Let's see what I'd like, if I can go to see, click share. If my I always have a difficulty trying to get it to. I have the slides on my screen and I'm clicking share, but I don't know if they're being shared.
We can't see them right now. Do you want to, is it something you can email to me and I can share for you? Would that be helpful?
Oh, I wish
Or
I
is it,
thought that earlier.
so what do you, when you say share, it should give you options. One thing I have to do is put everything down on my computer and then only pull up that one PowerPoint. Then I click on the Zoom button and then I share, and that's usually what will show first.
Okay. Okay. Would it be just to share it to the desktop? I'm sorry for this technical issue right now, but I mean, otherwise I can just verbally talk too. But let's see if I can.
Or I could let Sarah go, and then you can email me it, and I can share. And well, she's talking.
Yeah. What if you could let Sarah go next, and then I'll email it to you.
Okay, perfect.
Okay, guys, do you see a slide with a blue circle? I have 700 things up on these slide screens here, but I just have this one
Yes.
slide to share. Thank you. Um, just a little bit of an update. I know we've talked to folks before about trying to mobilize both enthusiasm, participation, and funding to develop a Center for Global Health here. And we also all know this is a rough time to be looking for additional sources as our institution as we navigate, the next couple years. But we do feel like there was really a good, strong response from folks of feeling like, yes, we need to mobilize around and start putting all the bricks together to build a Center for Global Health and doing what we can do without external funds or internal funds to progress at the moment. And so just wanted to highlight some of the things that we have been trying to do in 2025. And I guess just to be clear too, when we talk about the center, we already have like thriving activities for global health education, as you guys are all hearing about, and a lot of our exchanges and the work that OIP does. But one of the pillars that we recognized wasn't really formally represented under our global health work is research. And so we were working to try to be intentional on how we strengthen the capacity for that. And so in this interim period, as we just continue to try to mobilize support and engagement, we have had the opportunity, and I kind of want to use this opportunity to remind everyone that if you are engaging in global health research formally or informally. So if it's just evaluating, for example, like Michelle, the work that you're doing and evaluating that impact on students, and you want to consult or think through the baseline assessment that you're asking, the follow-up evaluation surveys that you're asking, to please feel free to reach out and consult, because what we hope to do is be able to have the capacity and support to have some staff consultation as far as global health research. And so right now it's myself and Catherine Wexler, who goes by Katie. But even sort of without formalizing this yet with funding, we have had the chance to be involved in a few things. And I wanted to highlight some of those here and also invite more people to reach out if this is relevant for you. But our Cancer Center, we put in an NIH administrative supplement to the Cancer Center for a call that came out specific to trying to build the research capacity of global institutions. For those, probably many of us have heard about the changes to the NIH in May of this year that were restricting our ability to have sub-award contracts with our global health partners, which is the model we've always done for NIH research. And the pathway that they're describing for moving forward is that our global partners are going to have to do all of that administrative reporting and financial reporting for any federally NIH funded grants. It's a huge burden to put on an institution that gets 8% F&A compared to one that gets 54% F&A. So this administrative supplement is to work directly to try to build the research capacity. And when I say that, more the administrative capacity to manage grants and to be familiar with all the NIH reporting that sounds like it's going to be a requirement moving forward. So in this administrative supplement, we're working with one of our partners in Kenya, Global Health Innovations, with their grants manager. And it's a nice collaboration between the Research Institute at KUMC and Global Health Innovations, so that as these NIH policies move forward, our partners can hopefully be much more prepared to respond. And so I think if we get the supplement, what we learn from that and learn from partnering with Global Health Innovations can be well documented so that other teams from KUMC who are doing international research with partners can share some of these resources and strategies with the partners they work with and help build their capacity to be able to apply for or be a partner on NIH funded grants. we haven't heard back. Fingers crossed on that one. Dr. Headings and Dr. Templeton put in a Gates Foundation proposal, and our team was able to help work with them to review and help draft and help get that proposal ready and submitted. When Dr. Trujillo went to Ghana, she was starting to incorporate some of the trainings that she does on the Helping Babies Breathe, doing a little bit more formal pre-post assessment on the impact of the trainings. And so that was some easy little, just a few consultations and feedback on refining her research tools for that. And I just as I pause on that, I think that's part of like, while we don't have a lot of external funds to be doing this, we really thought that's some of the low-hanging fruit. All the great clinical work and education work that's already happening, just layering a little bit more formalized research into that. And then we can call it program evaluation essentially. But having those data analyzed and ready are essential building blocks when you want to apply for a grant or apply for external funds. Consulting on how to set up foreign subawards, how to navigate some of that paperwork with RI. We've had some people reach out for just helping to guide through that challenging process. And then one of the things that was on the agenda for today is just revisiting our website. I think we've all talked about for several years how we feel like it's really hard to capture the work that everyone's doing in one spot and try to keep it current. So Catherine Wexler, Katie, and another team member were roping into that. Jeff Fields and James Herring are working with us too. And sort of look at what could that look like and how do we want to build out and feature some of the global health research, working with Kimberly and team too to really kind of integrate the content that already exists with OIP for education and exchange, build in the research component and try to build it under one umbrella. So I wanted the chance to say that out loud because we want to make sure we're featuring people's stories. And so if you are engaged in any global health research or have just kind of like a great showcase. I mean, Michelle, I think some of the work that you're doing that you just described today would be great to highlight. We want to make sure that we're including that. So if you have something you think would be great to include, please reach out to myself and Katie. I have our emails on the bottom here. Make sure you guys can see that so that we can feature it. We are not ready to show anything live. It's still totally on kind of a staging platform, but just thought that's something we can trudge along on as we wait for maybe some bigger investment in the center. So hopefully that's a 2026 deliverable. And then
Awesome.
yeah, I just said the last one is just sort of, engaging in global health research with students, which I feel like, many of you advise on that work. But if we think just a bit intentional to really document that and, ping us for that so we can be capturing it, because I think so many of us, we just do it and then, maybe it hits our CV as a student that we've mentored, but particularly if it's in global health, we want to capture that because we also want to have a component that's we want the website to also be very student facing and have a clear way that students have a way to access the resources and the opportunities they're looking for across the board. So those are our updates so far. Does anybody have any questions or suggestions?
I think the documenting on the website is so important. And again, I know we've been talking about this for years, and it's also something that's organic and ongoing, right? So, having that structure in place and then being able to continuously add and build is so important. So I'm really grateful for Katie working on that and with you, Sarah. Thank you so much. Other comments and thoughts? Okay. Well, Dr. Kovac, I did not receive, excuse me, a PowerPoint by email. Are you going to just talk to us maybe?
Yeah, you know, I'm just not having any luck. Uh, I'm sorry.
That's okay. If you'd rather wait till the next meeting, we can do that as well. And going forward, I'll just collect PowerPoint in advance to help out. And we typically do that for events. We'll just do that for this meeting as well to make it easier on everybody and reduce the stress a little too. Sorry about that. I should have thought of that in advance.
Why don't we just do that? Because I have some pictures I'd like to show, and
Yeah. Yeah.
I just do it at the next meeting.
I think that'll be perfect. And so we have a good lineup, and there's still some coordination between it because Lisa will be talking about Dr. Trujillo will talk about her summer. So there's a little connection there. And because of Ghana, right? And then you can report as well, and Dr. Sigler. So for this group, I would like to say that we would like to open it up at this time for ideas on what you would like us to be doing as a group, what you would like us to be presenting, any ideas, and also any additional recognitions that we might want to make before we end our meeting.
Maybe Kimberly, just a comment. This is Maria.
Please.
This is just again more a comment. Kimberly and I have been working together on a certificate of distinction for medical students on global health. So as I was looking at this platform, Kimberly, I was thinking, so probably a lot of the mentors that the students will be seeking now are going to be some of you. So I wanted to give you a heads up, and if you are particularly interested, maybe just reach out to Kimberly and myself so we can chat more about that. But yeah, I just wanted to put it out there. Kimberly really seems to be connected to this group, and yeah.
I agree with you, Maria. Maria, and I had also thought about Dr. Ofedudu when Sarah was talking about the research, because so probably if you're in the School of Medicine, you've heard of the School of Medicine Certificates of Distinction. And Dr. Ofedudu and Maria, you can help me. There's 5, right? Am I right? 5 areas. And one is research.
We have 8.
We have 8 areas. Okay. Okay, and Dr. Ofedudu is over the research. As Maria said, we're developing and directors for the global health. So Dr. Ofedudu, do you want to say any more about that at all, just for people's awareness?
I think you folks have said enough about that. If for the class of 2029, if a student takes certificates of distinction in research, they have the ability to take another certificate of distinction, and it could be global health, it could be bioethics, it could be lifestyle medicine. So what we are trying to help the student do is that if you have any research component as a requirement for the COD in global health, the student can double dip, if you will. They can use that research to meet that research requirement for COD research, and then also do that for the global health. So, but if you have any questions about that, I will be more than happy to talk to you about it and then see how best we'll be able to help our students to meet those requirements, especially for the research. The other requirements, then you can work with them to meet those other requirements. But in terms of research, we will try to make things easier for them. But for research, it has to be published. The requirement says that it has to be published, and the student has to be the first author on that research, and the publication has to be in a PubMed indexed journal, so they can't just publish anywhere. And we've increased the requirement a little bit for them. So thank you very much.
Yeah, thank you. And that's quite a high bar for the research COD. I know for Maria and me.
Yes, that is very high bar for them. So
yeah, we have a capstone, and Maria was talking about we will be needing faculty mentors for the students for those capstone projects. And we were also thinking that our partners, our international partners, would be a great set of mentors as well. So we'll be reaching out to a lot of you as this develops and as students engage for sure. Thank you for bringing that up, Maria. Anything else? And Dr. Korntager, I saw your comment about Project Cure. That would be awesome. That's I like that idea. And it's interesting how little threads are woven through different projects. I know that Project Cure is working with the orthopedics, and I had just reached out to Dr. Headings to connect Dr. Kovac about Project Cure. So it sounds like maybe you could introduce Dr. Kovac to Project Cure if you have a good connection. Maybe that's.
Yeah, I'm actually now on what they call their ambassador board.
Okay.
And so, yeah, I'd be happy to. Toy is the name of the woman who is running the Kansas City operation now. We're actually in the midst of getting a new executive director for the Kansas City location. But I think it's a great group, and I think it gives some opportunities for students as well. I've had students, medical students there, and it gives them sort of a different kind of perspective on needs in other places.
Mm-hmm. Well, I've only heard really good things about Project Cure. I'd love to learn a little bit more, and that's from the orthopedic surgery, reports and their activity. So I think you and Dr. Kovac need to connect. There's money for the shipping, and they need equipment. So it seems like Project Cure is the right connection. So yeah, if you would plan maybe at our next meeting, could you do that? And Stacy, do you know off the top of your head when our next meeting is?
It would be November 13th, I believe.
Okay.
Yep, 13th.
Great. All right. Well, I'll put together an agenda for that sooner than later and confirm with those people who have said they would talk at our next meeting. Dr. Ofedudu, is your hand up?
Yes.
Go ahead.
Yes, ma'am. Thank you very much. I just want to let people know that I put a link to all the CODs in the chat. So we are still working on the website, but you can get a little bit of a taste of what those CODs are. Thank you very much.
Thank you. All right. Well, I appreciate the conversation today. Thank you so much, Michelle, for your wonderful presentation. Sorry for the problems, the technology problems, Dr. Kovac. And thank you, Sarah, for your update. It was really informative, and all of you for attending. Have a good day.
Next time I'll send my slides to you beforehand.
Yes, I appreciate that. Go ahead and get them sent to me, Dr. Kovac.
Bye, guys.
We'll save them. Bye.
Bye. Thank you.